Democrats in the North Carolina House of Representatives have filed a bill to expand Medicaid in North Carolina. Now, that plan would add roughly 500,000 or more people to this government health insurance program. Many of those 500,000 or so able-bodied, working-age adults with no kids. Our next guest says that there is a better way to expand access to quality health care than expanding a flawed program that's been plagued by waste and abuse. Jordan Roberts is the healthcare policy analyst for the Locke Foundation. He joins me now. Jordan, welcome back to the show.
Thank you. Glad to be here.
Can you explain for us, first of all, how Medicaid works, how it's funded, and who it's designed for?
So the state runs the Medicaid program, and the funding comes a portion from the state and a portion from the federal government. That's determined by a percentage, and the state largely runs it, and it was supposed to be for, the most at-risk populations, those with disabilities, and the most low-income folks out there.
This is decades upon decades old.
Right. And it's been this way since 1965. It's an open-ended entitlement. There's no caps or no cost-saving measures to in this program's financing.
But there are income qualifications, are there not? I mean, it's meant to be, as you said, for the most vulnerable population.
Right.
So not anyone can be added to the rolls.
And the state determines that and determines the benefits that these enrollees get.
The reason I ask about the funding, Jordan, is because one of the key talking points for those who believe that expanding Medicaid is the right thing to do, which of course the John Locke Foundation does not believe that. And we'll talk a little bit about what we think is a better way. But the supporters will say it's essentially a free program to the state, or nearly free. What do they mean when they say that?
Right. So when we talk about Medicaid expansion, this was a part of the Affordable Care Act, and the Affordable Care Act said if you expand to the states, if you expand your Medicaid program, we'll give you 90% of that funding, and you guys, the states, have to pick up 10%. Now, a lot of people like to say that we're missing out on money by not expanding Medicaid, but that's just not true because they're all federal tax dollars, and there's not a fund of Medicaid expansion money that we're missing out on, that we're contributing anything to. And when we talk about the fiscal shape of the federal budget right now, $22 trillion in debt, odds are that this funding percentage will change, and the state will be on the hook for a lot more than 10% in years to come.
So down the road, there would need to be additional state spending on this program should it be expanded.
Absolutely. And if you look at other states, what they've found is their projections right now, North Carolina's projection, the state would be on the hook for roughly $340 million, but all the other states that have expanded, most of them have seen costs significantly higher than their projections, and that gets paid for by the state.
Jordan, when we talk about a program for the most vulnerable people, I think many people will say, look, we can understand that this is an appropriate part of our social safety net, people who are disabled or living on the margins who need some sort of assistance, a helping hand up, so to speak. But when we talk about expanding Medicaid in North Carolina, that population of about 500,000 people or so that would be added to the rolls, the vast majority of them are adults of working age, able-bodied, not disabled, and have no children to support. So there seems to be a disconnect between the goal and the mission of the Medicaid program and now this group of people that the supporters want to add. Tell us about that.
So when you expand Medicaid, what you're doing is inflating the amount of money that the government spends, and that's a main reason why the healthcare costs around the country are so high. Government spends so much money, and that moves the goalpost of what healthcare costs. So if you keep Medicaid to its traditional populations, we can do a better job managing those people and keeping costs down for them. But when you expand it, we are moving the total amount of money that we are spending on healthcare in the state.
If we expanded and added those people to the Medicaid rolls, Jordan, would that in any way crowd out people who legitimately qualify as a vulnerable population?
Absolutely, and that's the main concern here. So expanding Medicaid, it does nothing for it. it only increases the demand for healthcare services. It doesn't do anything for the supply. And what we find around the state is that there's shortages of physicians and facilities. So all expanding Medicaid would do would be to increase the demand where there's not enough facilities to meet the current demand, and that has an adverse effect on the population that Medicaid was supposed to be for, and makes those people worse off.
So the obvious question is, if not expansion of Medicaid, then what? Because there are people who evidently have no insurance, and there are concerns, bipartisan concerns about access to care. You say there's a better way than expanding Medicaid.
Right. I think it should be a more high priority goal to lower the cost of care all across the state, and we can get more people into these private insurance markets and get more people paying into it, rather than just expand government health insurance that many times is not adequate, and there's not enough doctors that accept new Medicaid patients. And so it really doesn't address the problems of access and patient affordability. So if we reform some state-level policies that we can get better facilities, more facilities, cheaper facilities, and cheaper access to care, then we really wouldn't need to expand this program to get more people onto government insurance.
You have written about a number of barriers in particular. One of them is called Certificate of Need. Help us understand this government permission slip, essentially. Help us understand how repealing that, or at least paring it back, would increase access to care and help people who really do have a need.
Mm-hmm. So a lot of I think it's a common misconception that in healthcare you need to get care done in hospitals, and those are the most expensive places to do it. And Certificate of Need largely protects and insulates hospitals, and that's where the majority of these new Medicaid patients would go. So if you repeal Certificate of Need law, what it would do is open up a lot of the supply reforms and get more facilities into the state, and a lot of times these are lower cost facilities compared to hospitals. So if we open up the amount of facilities, then you address the problems of rural access and cheaper care, bringing down the cost of care all around the state, and it would address all those problems.
You also have written about the issue of shortage of access to medical professionals, doctors in particular. Are there ways then that we could maybe amend our licensure laws to make sure that people have access to folks who have a high level of knowledge but maybe aren't actually a medical doctor?
Right, so licensure laws prohibit any doctor that's not living in the state to administer care to North Carolina patients. So if you knock down some of those barriers, you open up plenty of avenues for people via telemedicine and telehealth to get more access across the country with physicians that address their needs specifically, and largely licensure regimes in the state are what's holding back that access.
And also access to, for example, nurse practitioners who have a high level of skill but aren't medical doctors but could take care of some basic needs.
That's right. So it's all a matter of allowing people to practice up until their full training, and reforming licensure regimes would accomplish that.